You're listening to Traumedy, the podcast that helps you take your pain and play with it. I'm Nancy Norton. I am a comedian, former nurse, keynote speaker about the power of humor, why we need it, how it helps us. And this is a special week featuring a scientist. And I think it's very important under this current administration that we do all that we can to help sustain medical research. And our guest this week is part of a big event at the Bug Theater in Denver. It's called Headstrong Comedy through brainfestdenver.com. And this episode, I learned so much that I did not know about female brains.
But one of the things that when I did my menopause, surgical menopause study, where women were enrolling in my study for executive functioning problems, they said to me, and it didn't matter because I enrolled people from all over the country, and they said to me that they had been to their primary care doc multiple times, and they said, we just don't know what to do. And I felt really sad. That's why I'm doing the study. And to a T, all the women, I mean, some of them have been suffering 5 years, 10 years, 15 years. They said to me, thank you for doing this research.
It's 4 scientists, 4 comedians, September 5th at the Bug Theater. We need this information. Look in the show notes. You can find tickets. It's going to be a great night to come together with like minds and laugh, but also learn and also find ways to take action. So, very important. And thank you for tuning in. And again, thank you for being a listener and part of the healing journey that we're all on. That's what Traumedy's all about. So we need each other. So thank you for being a listener. And I know it makes a difference just having you out there. Let me know if you'd like to be a guest on Traumedy. If you have any questions, you can always reach out to me through my website, nancynorton.tv. That's nancynorton.tv, like television. Let me know how I can help. All right, let's get going. Enjoy this episode. Welcome to Traumedy. My guest this week is a psychiatrist. She is the chair of the Department of Psychiatry at CU Anschutz. Please welcome Dr. Neill Epperson.
Yes.
Is that correct? We say CU, Colorado University, Anschutz.
Well, instead of saying the University of Colorado, that's a whole thing here in
see,
Colorado. But we all call it CU instead of UC. You know, it has something to do with sports.
I believe that.
My husband explains this kind of stuff to me, and it goes in one ear out of the other, and I just go, okay, see you, whatever. You know, I've been here for 7 years as the chair of the department, and it's a great department. I give a shout out to all my people. I love my department. Some of the most mission-driven faculty members, staff members, and trainees you'd ever want to meet, all there to help the mental health of Colorado.
This is beautiful. I got to tell you all, I downloaded your CV and I was just like getting sweaty palms. Like, this woman is a genius. I'm interviewing a genius.
Hardly.
Well, I don't know what the qualification, I don't know where the line is, but I mean, 86 publications, reading through them, just like, whoa, this woman is dedicated. I mean, to do that much research.
Well, you have to. I mean, that's part of our job. And so it's not like I do this, and I have another day job. I mean, seriously, before I became chair of the department, I was a physician scientist. So my job was to try and really help translate, do research, and also do research that I think is going to help my patients. And so that's my job. So of course, over the years, you accrue publications, and, since I've been here at CU, I've been able to continue that work, mainly through working with a lot of junior people in my lab who are doing such amazing work in their own right. And then they write the papers and I help them. And so it's great. I scratch their back, they scratch mine. And so we can all, get our publications out there. It does, there are a lot of people that work on these things. So it's not just me.
You're very humble. I do know that's true, that it takes a village to write a research paper, because just the little bit of citations that I've done in my work as an RN and as a person who got certified in therapeutic humor, we just read a lot of these peer-reviewed studies, and I don't even understand it. I don't even understand how it all works, but I've tried to fake it. Fake like I understand research. And so,
well, it takes a village to do the research,
yeah,
too.
that's what I'm saying.
Yeah.
And then, but it takes passion. And that's the thing. When I first met you, so we met each other on a Zoom call because we're getting ready for a show at the Bug Theater September 5th. And this is what we really want people to know about because I mean, I want them to know there's just so much that you have to offer. But we are, the thing that's coming up September 5th in Denver, the Bug Theater, is called, what is it called? It's not
Headstrong Women. Woo-hoo!
Yes, Headstrong Women.
Yeah.
And it's for scientists.
Yes.
You are one of the scientists.
Yes, I am one of them.
And then it's for comedians. I'm one of the comedians.
Yes.
And so we're trying to find a way to make it not just fun, because we do want to make it fun and funny, but we want to inform people, we want to empower them,
right.
We want to help people take action under the current administration. I like to call it the Dark Lord, but you know, that's my terminology. I just did a keynote for research administrators, you know, this is the International Society of Research Administrators, and they're just, I mean, they're kind of green. They're just like every day, the grants are getting cut. I guess we're coming together to help raise awareness around how important research is.
That's true. How important research is, how important women's health is, and particularly how important women's brain health is. And that, you know, a lot of the themes that we're going to all sort of weave through the night is, you know, women are not just small men.
Yes,
you know,
whatever those songs are where we're called Shorty. Hey, Shorty.
Oh, yeah.
Yeah.
Get down, Shorty. I'm like, I can't get down that. I am like 5'10", so I don't go that low.
But I'm not touching that line. I want to. I'm like, it's not headstrong for that reason. Anyway, folks. Oh, okay.
Now we're going there.
I'm sorry.
There you go, Nancy.
I know. I hang out in too many comedy clubs and drink bourbon. I sip whiskey and talk dirty.
Where's my bourbon?
I know.
Seriously, we're doing this in the afternoon. We should have been doing it at 9 o'clock.
I do have some fresh mint. We could try to make a mint. You know what I mean? Whatever that is.
Mint julep.
Yes, because you're Southern.
I am Southern.
You know, listen, I know we're going to have a lot of back and forth, and I'm interrupting you a little bit here, but we're not just short men. We're going to come back to that. But right here, I just want to insert, you are really grounded in, you know, like you say, you're kind of like a country girl at heart.
Yeah. Yes. Well, I grew up in the country, yes, of North Carolina, and worked in the tobacco fields every summer. And one little known fact about me is because I didn't come from a family of means, and you know, my mother had really terrible taste in clothes, and she always bought me really cheap clothes that I didn't like. And so I figured out I have to work. So I worked in tobacco in the summertime. But then when I turned 16 and got my driver's license, I couldn't, you know, all through the school year, you know, you can't work in the fields because it's wintertime and that kind of thing. And I'm like, oh my God, what am I going to do to make money so that I can get the pair of Levi's I want instead of these ugly jeans that my mother would buy for me? I got my driver's license, and within a week, I was driving one of those big, long, yellow school buses full of elementary and middle school students. Yeah, cha-ching. I mean, seriously, making money. But who in their right mind lets a 16-year-old who just got their driver's license drive not just a car, but a big, long, yellow school bus full of children? It's amazing. Seriously, who does that?
You are a born leader. I'm telling you. The fact that you actually had the guts to go and say, I'm going to apply for that job and get it. And I bet you handled your responsibility well. Am I right?
Well, nobody died, thank God. And I had no injuries either. So that was good. You know, because those kids didn't have seatbelts and stuff. So they could have flopped all over. Because you have to understand, I was driving down some back road swamps in North Carolina, and there were bumps and pits. I mean, when we're talking about pits in the road, and I'm having to steer this big school bus through all of that, and these kids are bouncing up and down in the back. I'm like,
and they're loving it. They're
loving it. But I'm sitting there going, and I'm too young to even think about that. I'm too young to even worry about it.
Isn't it interesting how I think about some things I took on as responsibility that I would not take take on today. Like I would, well, I have the divergent eyes. I should never drive. I probably shouldn't even drive a car. But I do have a lot of angels. As you know, I'm very spiritual, so I count on my driving angels, keep me safe, and others. I mean, I would like to get a self-driving car. I drive a 2008 Honda Element. I would like to get one of those that at least beeps when people are on my sides. But you ever think about that sometimes, where you take on responsibility before you knew what you were doing, and then you're like, wow, I can't believe I did that.
Yeah.
You've done that. Looks like, according to your CV, I mean, I just, honestly, it does blow my mind that all the roles that I saw. I mean, you came here from Yale. Like, you were a professor at Yale. It looked like very soon out of med school. I don't know. I try to remember the timeline.
Well, that's not uncommon. I mean, so I did my residency training at Yale in psychiatry, and then I realized in my third year of residency that I really didn't want to be a private practice child and adolescent psychiatrist, and I was like, holy crap. I came into psychiatry because I thought I wanted to do this. And I went to my psychoanalytic supervisor, this wonderful gentleman named Wayne Downey, and I said, Dr. Downey, I think I failed. And he said, why would you say you failed? I said, well, because I came into psychiatry to be this private practice child and adolescent psychiatrist. And I said, I think I'd rather stick a needle in my eye. And the truth is, I think he was relieved because I was not very good with the whole psychodynamic stuff. I just didn't, I didn't get it. It didn't understand it very well. I was attracted to it, but it was kind of like, I think I really want to understand why people do what they do from a biological perspective. And he told me, he said, Neill, you haven't failed. You just need to change your ego ideal.
Oh, interesting.
Exactly. So that's what I did. And about that time, I met a patient that had postpartum depression. And I was saying to you before that patients can be our muses. And so I've always treated patients. I mean, I have, and I really value working with people. I just couldn't do it day in and day out. I needed research. That's my jam. But this patient really helped me start to think about the effects of hormones on the brain, because she was experiencing new onset postpartum depression and these obsessional thoughts that were really upsetting to her. And I was like, oh my gosh, how does this happen? That, somebody who's never had depression or obsessions and compulsions, all of a sudden in the postpartum period, when they're supposed to be able to feel comfortable taking care of the baby, she was hiding from her children because they would trigger her having these bad thoughts about them.
Yeah.
And so so bless her heart, we helped her, and she got better. But I also started reading about how hormones affect the brain, particularly in females when we go through these reproductive shifts. And I was like, oh my God, this is fascinating. Why didn't anybody ever talk to me about this in medical school? And so it launched my career studying the effects of hormones on the female brain. And I haven't looked back. It's been 30 years and it has just been so rewarding. And all along the way, all of my research, I would say patients and my interactions with people and hearing their stories and saying, why is this happening to this person? Like, why did this person get depressed for the first time in the menopause? Yeah. Or why did this person start to have cognitive problems when they had to have their ovaries removed to decrease their risk of cancer? I'm like, what's going on here? And those are the kinds of questions that I've spent 30 years trying to address so that we can actually improve women's health.
Actually improve it. That's what's coming up for me is like, and back to your groundedness from your childhood of like, when you're in the field working in a tobacco field, you're a real person. You're not just doing this as a theory. But not only that, it's like what I'm getting from you and the passion that I love is that it's got to make a difference. Yeah. It's not just here to get a paper, to say I did this, to some theory that you want to be the one that found it. You want to help people and apply this information. And also, I'm just thinking about my own mother, as I told you on that Zoom call, because it actually, the more I'm really in this forgiveness phase with my mother and some of our relationship.
God bless you. God bless you.
Well, it's something, it helps that she has passed on. I got to be honest. Yeah. She's no longer a threat to me. But because that's true, she had some behaviors that were threatening.
Yes.
And I also just want to say, I bet there are there's someone listening who had had postpartum thoughts, postpartum behaviors that they are ashamed of. And I do believe, I mean, this came to me during psychedelic trauma therapy, and I don't know how much access you can trust from pre-verbal time, but I do believe my mother did things that she was deeply bothered by. And that she could never tell anyone.
Sure.
Because the shame and the stigma of mental health. And then just think, I know there's some women listening who have
no stigma for mental health. There's stigma about mental illness. We all want mental health.
Oh, good point. Good okay, thanks for differentiating that.
Yeah, because everybody wants to have mental health, but we don't want to talk about mental illness.
Yeah, and our own struggles. And also just, I mean, I bet there's so many women who had to suffer in silence.
They did.
And self-medicate. But I just want to say, I think this is a gift to people to know, like, hey, there's help for you. There's also to help people have compassion for themselves.
Well, absolutely. My earlier career, I focused mostly on perinatal mental health and working with women who, were experiencing, either like even post-traumatic stress after, a very traumatic delivery, or postpartum depression, postpartum OCD symptoms, anxiety, and what have you. And, one of the things that I would always say to them is, if you're not having at times, a negative thought about your child or even a hostile thought because you're exhausted, the bottom line is caring for another person. In all relationships, we have positive and negative feelings. I think that women are, kind of assume, maybe because we don't talk about it enough, and they've just drank the Kool-Aid, that you're supposed to be just in love with your child and it's all supposed to be, hunky-dory. And yes, you get tired, but God forbid that you would have a hostile thought towards your child. And the truth is that is really very normal and common. Just because you think something
and maybe
negative,
healthy.
Yes.
Maybe healthy. Allow the thought so it doesn't build up like my mother's into a rage.
Yes, exactly.
Because I do believe, if you suppress that and then it comes out sideways, like let yourself have those thoughts and be mad. And
yes, and it's what you do with it that matters.
What you do with it.
Exactly. And so, like I've worked with people who, they have thought, oh my God, I used to work on Wall Street and and I'm 40 something years old having my first child, and, they come home and then they decide they're going to stay at home with their baby, and somehow they're going to do it so much better than their own mother did. And I look at them and I go, what made you think you were going to enjoy this? I mean, seriously, what made you think that, and I said, it's like when you're on Wall Street and you finish a project, or you go and you do a negotiation, or you make somebody a lot of money or something like that. At the end of the day, your partner's going, oh, let's go out and have a drink. That was great. Your baby doesn't look up at you after you take it off the tit and go, fantastic milk, Mom.
High five.
High five. That was the best. I don't know what you were eating, but gosh, bring it on. Seriously. I mean, so why would somebody who has experienced this for like 40, their whole professional life, think that staying home with a baby that is like a little vampirino that is just, sucking you dry is going to be so rewarding? I mean, seriously, I've told many women, you need to change your ego ideal, because what you thought was motherhood was some fantasy land, sort of like me as in private practice. I wouldn't have been good at it. It's just not what I would have been good at. And as a result of that, because when I got recruited here to CU, a lot of the people in the department went, oh my God, she's such a researcher. She's going to be, only thing she's going to care about is research. And, it's a very clinical department, provides a lot of clinical care. And what they didn't know is that I have great respect for people who can do things that I can't.
Yeah.
And so if you're a really good clinician, wow, props to you.
Yeah.
Because I'm just not good at that,
And you're able to celebrate other people's skills that you don't have, or whatever.
Exactly.
You're not all just tunnel vision one way.
No, absolutely not. And so, we've really grown the clinical services at the department tremendously, because again, I mean, we're the only academic medical center in the state over at CU Anschutz. And so, I really think of us as the the state's Department of Psychiatry, and that we need to be, part of our mission has to be to really improve the mental health landscape of all of Colorado. So we can't just sit in our little ivory tower and take a few patients, to help train our residents. We have to really think about caring for Coloradans. And, we can't treat everybody because, we're not that big, but we can do things and leverage the kinds of programs you can build in an academic center to help the mental health care out in the community.
Well, so how do people come to you? Like who are your clients that come to the clinic?
Sure. Oh, well, we have people who come to the clinic in the traditional way, but then of course during the pandemic, we wound up doing like all telehealth. And so now we still do probably about 70% of our cases are done through telehealth. At least in some of our clinics. Some of our clinics, we really need the patients to come and see us more.
But can anybody access your services
Yes,
if they have the right whatever insurance, I guess?
They just call them up. And we also take Medicaid and Medicare. And
I just got on Medicare. I don't want to brag, but
oh, I know. I'm
pretty excited. It's like winning the lottery. My last insurance bill was $1,100, so I'm down to $300 something. I don't know.
Yes, that sounds awesome. I know. That's just a few years away for me that I'm going to be hopping on Medicare myself.
If it still exists under the Dark Lord. Okay.
Oh, yes.
I'm sorry. I got to stop saying that.
No,
but I want to just say right here that I am responsible for my own comments.
Thank you.
I mean, and the thing that we are doing together at Bug Theater on September 5th is, I know that one of the things I heard, we were going to try and have a call to action. Like, I don't know, how do we, is there anything that people can do to help
oh my gosh, yes.
research or help
yes.
to make sure that we keep,
yes.
I mean, I do have the 5 Calls app on my phone, which I call my senator and my representatives. And I know I jumped from who comes into the clinic.
Well,
okay.
let me finish that one.
Yeah,
let
let's
me
finish that.
Okay.
Bookmark.
So people can come to the clinic in the very traditional way, call and, give their insurance and what have you. But we also do a lot of work. We have a program called COMAP, Colorado Mental Health Access Program. And that, because if you think about it, uncomplicated depression and anxiety, about maybe 75% of the people with that get treated by their primary care docs. And their primary care docs, also can do a lot. And in Colorado, you're not going to have a psychiatrist out in the frontier area because there's just not, maybe there's a few, but the population is not large enough to support having someone with that particular specialty. So how do we get that specialty out in the community? Well, first of all, we can support our primary care colleagues. So if they wind up having cases that they feel like they need to have a psychiatrist, either a child psychiatrist or somebody who works with pregnant and postpartum women, somebody who works with elderly or people with addiction, they can call COMAP in our Colorado Access Program at the campus, and they will be able to talk to a psychiatrist that day. And the psychiatrist will have expertise to help them think through a case. So that's one of the ways in which we can extend our services out into the community, because we can't put a psychiatrist everywhere. It's just not going to happen.
But they have you as a resource, and
exactly.
They can feel confident when I make this prescription for, like, for example, I'm just going to give you an example because I use my podcast selfishly. I just realized after my son got diagnosed with ADHD, and I don't know, I was like, I see myself, even though he's adopted. We have so much in common. It's amazing. My primary care, she's like, I don't feel comfortable with your age going on a stimulant, because of the risk of stroke or something like that. But I did find a psychiatrist who would prescribe some Vyvanse. And
yes.
I've been so happy with it.
That's great.
But then he moved out of state. So now I'm like, should I go and get another prescription?
Why not?
But at 65, I have low blood pressure. I don't know. I guess I know I also had to go off of birth control pills, which I was using for my this was back about 10 years ago when I was 55. I was using birth control pills to manage my menopause symptoms, which was irritability. And one time I did draw my fist back, wanted to punch my young child. And I was like, I need to get some help. It was I just want to say it was in cocked position. I didn't go forward with it. Although I did throw a wet washcloth at him one time really hard. And he will not let that go. But anyway,
yeah.
All right. That was all over the place. But I'm just saying, I just know some things with age have been limiting for me. Like, for example, because I loved being on, it was free birth control pills, by the way. And I was just on those as a way after as I was transitioning.
Yes. And a lot of women do use birth control pills because, you don't want to oops baby at the age of 49, 50. And, there are definitely people who get pregnant in their late 40s and even possibly in their early 50s, depending upon when they're going to go through menopause. And so, the average age of menopause, finishing menopause, is around 52 in the U.S., but it's a big range. Like I was 47 when I went through menopause.
Oh, kind of early, yeah.
Yes, exactly. And
You're precocious.
Well, I don't know. I was wondering, did I do something to kill my ovaries early? I was like, what
did you start your period early? I
was a late one.
So you had a shorter window. Maybe some part of your whatever, your body
my
wisdom.
Body was like, it was done.
Your body, was done. You had other things to do.
Yes, my ovaries were like, you're done. So I went off of birth control because I thought, okay, I've been on this for a while. Let me go off. And I started having hot flashes. And so I called my GYN and I said, Wanda, you'll never know. I'm having these symptoms. And I said, should I just go back on it? She goes, well, why don't you come in and see me? So she drew my blood and she goes, honey, you're all the way through menopause because your follicle stimulating hormone was really high. And I was going, holy guacamole. So I basically went on hormone therapy at 47 and I have loved it. I have been lucky to be able to continue it. But it's not for everybody and not everybody can use hormone therapy. And so one of the things that I have done as I've been working with people who are going through menopause, either a natural menopause or surgical menopause, which is predominantly my patient population now, now that I'm an older woman. Yes, I know. I graduated into being a menopause expert versus a perinatal expert. So in any case, or a menstrual cycle expert, because I was doing that for a while too.
Well, I will say as a patient, I would much rather see somebody who's had similar symptoms than not. I am going to a new OBGYN, and I mean, obviously just the GYN part, but I mean, they were like, would you want to see this male? And I was like, I will if it's trans man. I mean, if has he ever had a vagina? They're like, I don't think so. So I said, no, I will. I want to see someone who's had one, just to understand.
I have to argue that I have had some very good male physicians, and there's some beautiful, lovely. I mean, I met a really lovely OBGYN this past week. Just lovely. Okay. I mean, I would go to him in a heartbeat.
This is just my preference.
Okay.
So I want someone who can say, oh yeah, I know what you're talking about. Or I don't know, but it's not necessary. You're saying men can be great.
Yeah.
OBGYNs. Yes. I always find it an interesting career choice. There's just I don't know. There's just a part of me that's a little suspicious.
Okay. Well, in any case,
okay, that's my own trauma.
So the bottom line is that getting back to what we were talking about with primary care docs, I'm not surprised your primary care doc was anxious about giving you a stimulant because you didn't have ADHD. I mean, your ADHD wasn't diagnosed when you were a child, and some primary care docs just feel like, I don't know that I want to get into that particular medication. There's some, I'm not saying all, but I can just say I've met a lot of people in general medicine that feel uncomfortable with it. But it doesn't mean that a person shouldn't, find someone who does feel comfortable with these medications and can help you think through using them rationally. So, for example, I did a study in women who underwent a surgical menopause because they either had breast or ovarian cancer, or they were at genetic risk for that. And so, and basically they all said the same thing. Everybody told me that, yes, my metabolism could change. I could have a higher risk for cardiovascular disease. My bone density would, be adversely affected by the surgery, but nobody told me I might lose my mind. And again, it doesn't happen for everyone that goes through a surgical or natural menopause, but there is clear-cut evidence from my work as well as others that there is an increase in cognitive problems that people experience, particularly in something we refer to as the executive functioning domains, which, guess what, are critical for helping you keep 20 balls in the air at any one time and, paying attention and focusing and getting work done. And so,
which you're describing a women woman's life. You know,
Exactly.
we have to be.
That's a woman's life.
Especially if you have a family, and I mean, you have kids, right?
Yes, I have two.
So you've done it all. I guess I can't believe I'm still not over looking at it. I'm not over it. I'm not over it looking at the CV and even the signature line. I mean, you're the executive director of several other.
Well, those are programs that are in the department, so they kind of fall under me to some degree anyway. But yes, I've kind of given over those to some other folks in the department.
So you keep more than 20 balls in the air. And you're saying, have you been helped then?
Have you seen the balls? I think maybe what you should actually do is talk to some of the people at work, and they'll say, nah, Neill keeps maybe 10 balls in the air. We've got the other 10. We just pretend that she's got all 20, but no, we've got the other 10. We just don't want to tell her because, you know, it might hurt her feelings. You know, we wouldn't want her to think she's not all that, you know.
I know. You're from the South. You have to say these things. Yeah. But still, I tell you all.
I'm not just being gracious. I'm not. I'm telling you, I have fabulous people in my department.
And I do believe you. And I do believe that you would attract those kind of people and keep those kind of people around you. Because, I mean, it's such a treat to meet someone so scholarly, but also so accessible. Like, you have a personality, you know, I mean, because sometimes I meet people and I'm like, I can't quite, you know, connect. But you're you know, you have I think, a natural desire to connect with people, understand people.
I do.
You have a nice rapport. I just want to say.
Thank you. And that's one of the things that, you know, because when I went through medical school, because of that, everybody's like, oh, you should be a psychiatrist, and oh, you should be a clinician who, you know, your whole career is in, you know, providing clinical care. Because, yes, I do have those qualities. But I also have, like you said, I'm curious about, like, what causes the phenomenon that I am seeing this person struggle with? And, you know, yes, you can help that person through medications and psychotherapy. And I'm a firm believer in psychotherapy, love psychotherapy. I just wasn't very good at it. But it's really important. And so the bottom line is that you have to kind of blend those things together. So for me, I didn't become a basic scientist because I didn't just want to work with rodents, even though I envy sometimes people who work in that kind of laboratory because it's very easy to control mice. Well, it's not very easy to control people. They don't come for their research appointments all the time. So sometimes when we put them in the magnet to do brain imaging, they move, and then the data's crappy. So in any case, there's pros and cons with working with humans and working with mice.
Oh yeah, and you know, I am a vegan. I just, you know, I've been in and out of being a vegan, and I am one of those people that would like to go free all the mice. Okay. I got to be honest. Okay. I'm one of those people. I relocated 30 mice that were in my house, took them to a little fairy house in the woods. But then I also
the last time I looked, my menopausal women did not want me to take out a piece of their brain so that I could look at their dendritic spine density. So seriously, I mean, I can't do that in a human.
I know, but I don't think the mice want you to either. But because that gets complicated for me anyway, ethically. Okay. I mean, I do believe all creatures are sentient beings, but that's me. But I don't like cohabitating with them. Coexisting is one thing. Sure. And when they're in my house, I do relocate them.
That's very nice.
The most humanely way I can.
That's very nice.
All right. You know what's so funny? I wrote down, and this is so silly but I was looking through the 86 studies, but the one that caught my eye, which why does this catch? Because I'm a comedian. The one that was talking about sperm respiration. I was going to say, the line that I wrote down was stress increases sperm respiration in mice and men.
Yes.
What was sperm? I didn't even know sperm breathed. All this time. Anyway, I don't know. Why did I write that down?
I think we're referring to sort of mitochondrial activity. But no, we did. So Tracy Bale, who is organizing this with Christy, how do you say Christy?
Christy Buckley.
Buckley. So Tracy and Christy working on this together with a whole village to make this great event on September 5th happen. But Tracy and I are partners. So she does the mouse work and I do the human work. And so one of her postdocs doctoral student, Nicole Moon, a lovely young woman who is finishing up medical school, but did a PhD. with Tracy. And so altogether, we've been working on these projects where we're looking at the impact of stress and how stress that's experienced by someone before they actually conceive a child impacts the germ cell. So how do men transmit stress and a message about the stressful environment to the offspring? And so we have been looking at both in mice and in semen. So we take men who basically come into our studies. They give us 6 sperm samples, one every month. And we look at perceived stress, and we look at the changes, some of the changes in how the sperm swim, some of the other things that we're looking at that I won't go into because it'll bore everybody to tears. But it's very fascinating. You can see the impact of the resolution of stress. So like you go through a stressor, like maybe a test, or you lost a girlfriend or whatever, boyfriend, whatever is your preference. And then 2 months later, we can see it sort of a signal of that showing up in the semen.
It is fascinating.
And in the sperm.
And I don't mean, because this is like this is amazing work, but it's also kind of, I was picturing like, this is terrible, but I was like, who is masturbating the mice? I don't want to know. But that's none of my business.
Well, the men masturbate themselves.
Well,
so we don't do that. I do not do that. That would cross an ethical line by a long shot. But they do bring their little samples in a brown paper bag.
Okay.
Yeah.
Well, at one point when I was trying to conceive, and I was in a lesbian partnership at the time, my joke was always like, oh, my partner had a low sperm count, 0, and absolutely no testicles. And we kept trying. But then my friend, he did donate. I did try to conceive. It just was not, my body was like, we're not doing that. And, I conceived, I just didn't carry for long. And I was like, I trust my body wisdom, that was not for me to do. But what is my point here? Well, my dad had a huge trauma as a child. And I've always wondered, I've heard different things about, and I don't know if it does if this is just about a recent stress, but can that be carried on the DNA that I inherited? Because I feel pretty hypervigilant about a lot of things. He experienced a huge explosion that killed his dad and his sister, and he was there. And it was like, whoa, I do not drive. Like, he does not drive next to a tanker truck on the highway. We do not go into a gas station that's being fueled.
Sure.
But that might just be learned behavior. I don't know if there's things that you do. Is there anything about this that older stresses or?
Yeah, so even older stresses. And we've studied this in females and have published those data. That was a grant. So this is, again, why NIH funding is so important.
Yes, please.
Oh, my gosh.
Anything we can do.
So Tracy and I, when we were back at the University of Pennsylvania, so I went from Yale to the University of Pennsylvania. That's where I met Tracy. And Tracy and I started working together. It was a marriage made in heaven. And then she got married and moved to Maryland. And then I moved here, and then I moved both Scott and Tracy here. So now we are all here, and it's really awesome. But in any case, when we were back at Penn, we had a large grant from the National Institute of Mental Health and the Office of Research on Women's Health. And basically, this research basically helped us to study the impact of maternal childhood adversity. It didn't have to be abuse or neglect. It could be sort of a range of different sort of adverse kinds of experiences. And the impact on fetal development. We looked at the baby's fetal adrenal glands, which is the organ that produces the stress hormone cortisol. And we were basically wanting to see if during development, the baby's stress system could be impacted by mom's experience. And the answer was yes. We did see that. We saw it mostly in baby boys. We did not see as much of an effect. And this is where sex differences come into play. If you don't look at the sex of the offspring, then you wouldn't have seen, because it would have just kind of washed out the finding. But if you look at this by the sex of the baby or the fetus in this situation, you would see that the baby boys had smaller fetal adrenal volumes than non-baby boys of moms that didn't undergo this childhood adversity. And then we study babies at 6 months postpartum, as well as moms 6 months postpartum. And moms that had undergone an early life stress had a dampened cortisol response to our stressor, and their baby boys did as well, but not baby girls.
That's fascinating. How do you make sense of that? Do you have any theory about that? Why it would be with the males and not the females as much?
Well, there was just it's a complicated answer to that one, and I don't have all the ins and outs, but we do know that the male offspring can sometimes be more vulnerable to various perturbations in moms, and whether it's being during pregnancy, or like if a mom has an infection, or if a mom has to take, has an early birth or what have you. It can be a little bit harder for the baby boys. And again, if you think about it from a 100,000 foot view, when it comes to, say, for example, sort of evolution and sort of what's evolutionarily necessary, males being more sensitive to these adverse effects may actually be evolutionarily okay, whereas you need more females to keep the species alive than you do males, to be quite frank.
So females have to be more resilient to propagate the species. It makes sense.
The bottom line is that it may be adaptive. That's the issue. Just because you see a sex difference doesn't mean it's good or bad. And just because you see an effect of father's stress. So in that paper that we were talking about
with the
sperm
respiration of mice and men.
Yes. So stress actually resulted in the sperm swimming faster and straighter. So, I mean, sperm swim all different directions. They kind of make their way up the fallopian tube to try and, basically, cause conception.
They want to be the winner.
So, if it's a stressful environment out there and the male survived, so, because again, we don't see these effects on sperm the month that the man is stressed. We see the effects on the sperm when the man is like 2 months after the resolution. So he's been successful. So wouldn't you want that message to get to the offspring that, hey, I'm resilient, I'm strong, I was able to survive this breakup, and, I want to pass that on to my offspring, And so, again, a lot of this is all theoretical, but if you think about it from that perspective, it could be a good thing. I mean, everybody wants to equate stress as being bad, and that all stress is bad. Now, yes, watching your mother being assaulted is a bad thing. Having abuse or neglect yourself is that's a very, very painful, horrible thing. But, again, it's like we equate that stress with, okay, I broke up with my boyfriend, or I have an exam I don't feel prepared for. Well, yes, that's stressful, but, maybe the stress that you're feeling is going to make you actually study more the next time.
Right.
And if, maybe, yes, you're upset that you broke up in that relationship, but maybe that was the right thing to do. So stress helps us to pay attention. It helps us to pay attention.
Yeah.
There's overwhelming stress, like the ones that we were just talking about. And when those occur during childhood, as the brain is developing, we do believe that they're more pernicious, meaning that they have a much more negative and lasting effect. And quite frankly, I did an editorial for the American Journal of Psychiatry recently, and I was like, when are we going to stop child abuse and neglect? I mean, seriously, when are we as a species going to say that maltreatment of children, we just have to intervene? And war exposed children, because it's not just about maltreatment in the home, it's about maltreatment in our societies. And there are so many youth all across the globe who have suffered famine, have suffered from exposure to war, and loss of parents. I mean, whatever it might be. And we just accept that as a species. And I think that is just, shame on us.
I know. Our standards, I don't understand it either. I can't. There's a lot of things I can't. I mean, there's a lot of insanity in the world, let's just say. Mm-hmm. I mean, honestly, of course, my thing, I'm children. I don't know. I feel like there's a part of my psyche who wants to protect the vulnerable, the voiceless, the children, the marginalized.
And that's wonderful.
But, I don't know that I'm effective. I want to, and I've been thinking about what is mine to do, and that's where this research. I mean, all I know to do is call my senators, but I don't know is there anything else that you know of to help with research?
Sure, absolutely. So I mean, really, making those phone calls and standing up for science and is really important. And every time we have an assault against science, even if you think people are just eggheads and they're being paid just to sit around and think, that is not exactly what's happening. So I would argue if people don't appreciate science, that they try to learn more about it, so that maybe they would understand that this is really important to our survival as a species. We don't get cures for cancer without doing research, and we don't get cures for depression and schizophrenia and bipolar disorder and all these other things if we don't have research. So I would say, and again, if you come up with to somebody and you feel like they're kind of anti-research because they're anti-intelligentsia, or they are very suspicious of anybody that has more education than they do, try to be understanding. Try to be understanding that it is hard not to be suspicious of something you don't understand.
Yeah.
And so how do we help people? And that's one of the things about this, Headstrong Women is, the event on the 5th at the Bug Theater is really to try and destigmatize or sort of demystify research, and that it is actually something that we can all find accessible. And, I think that really helps. The other thing that really helps is philanthropy, because right now we're going to rely more on foundations. Like the Gates Foundation is just made a big announcement about doing and supporting research in women's health. I don't think women's brain health was there, which I was a little disappointed about. But, and again, the Biden administration.
Can we write a letter to the Gates Foundation?
Oh, sure.
And say, hey,
include this.
Yeah.
Include this. Yeah.
I mean, and also make donations if you have the wherewithal to do that.
Yes.
Is that what you're saying?
Yes. If you have the wherewithal to do it right now is the time to make donations. And you can fund studies, you can fund, various projects. You can reach out to, the School of Medicine and say, hey, I'm really interested in cancer care, or I'm really interested in multiple sclerosis, or I'm really interested in helping people with bipolar disorder. How can I help?
And it's a good thing to think about. I just did my living will, and I was thinking, like, that's a good time to put those kinds of
exactly.
How would people find, like, if I wanted to go, like, who, like on the 5 Calls app, it's really great. I highly recommend everybody get the 5 Calls app, because it does a synopsis of issues, and it also even gives you a script and it has the button. You just hit the little phone and somebody answers. Somebody will answer, like at Michael Bennett's office. Somebody answer,
that's great.
And we'll
great.
take your call, or sometimes you just leave a voicemail.
Yeah.
But is there a hub, or is there anywhere that somebody could go?
It's called CU Advancement. So, I mean, if you think about it, if it's hard to remember that, all you'd have to do would also say fundraising at CU. But if you want to give for medical or biomedical research, then, calling CU Anschutz and looking up the advancement office, Scott Arthur. So Scott Arthur.
I'll put a link in the show notes.
Yes.
I'll make it easy, and then you can send me the link, or we'll just pull it up and put it in there.
Yes. And he's the vice chancellor for advancement over at the CU Anschutz campus, and just an incredibly lovely guy with very mission driven. Really, again, some people think, oh my gosh, if I call and I ask about this, they're going to like demand a certain amount of money, or they're never going to leave me alone ever again, or whatever it might be. That's not how we roll. I mean, I have to say, Scott and his team are like incredibly caring, thoughtful, and what they want to be able to do is help people who want to help. How can we help you give in the way that you want to? But we're not going to hound you.
I love this, and it helps me feel like there's something in life, especially in this phase of my life. I want to leave a legacy. I want to do some good. I mean, it's really, I want to be of service at this point. There was a lot of time, like even as a comedian, I was like, me. I need attention from strangers. I'm from a big family. I'm not the 9th of 11, but I was born the 4th of 3 that were wanted. Anyway,
were you a whoops baby?
No, I really was. I wasn't. I mean, I think she wanted me to begin with, but then her mom died in a car accident when I was 2 months in utero, and she went through a big crisis while I was developing, right, at 2 months.
Oh my gosh.
So that impacted my in utero experience, my mother's life. She lost her mama abruptly in a car accident. So anyway, all I'm saying is, at that point, I think she was just overwhelmed, and it was like this, and probably had those thoughts. I was thinking about all this generational trauma that's maybe scientific, but also we recreate these traumas. I mean, she was fried. I was the 4th. And, grieving her. She died at 94 and she was ready. And I helped her transition with hospice. And even then it's still, I feel a little bit of chaos. It's been 2 years and I'm still like.
Our moms must have died about the same time, because my mom died just a little over 2 years ago as well. And there's something very powerful about that experience. And I think I'm still reeling from it. I hadn't been in psychotherapy for probably 20 something years. And then about 6 months after that, I was like, I think maybe I need to do some exploration on this. And I have to say, it's been incredibly helpful. So,
because I think after they pass, we have permission to look at things that we could not look at or even think and even say. Like, I'm saying things that my mother, she would be so mortified. But she's dead. So I figure, it's my time to shine. Even if I'm wrong, but I do couch it like, I don't know. Okay, so wait, I am jumping around with my ADHD, but I know there's a through line here that we're carrying. Okay, the research, I want to be of service. I really want to help make the world a better place. And whatever way I feel called to do that, this would feel really great to like change I'm pointing to my file cabinet because my living trust is here. But I just, whatever, I would like to give a little chunk towards something.
That's lovely.
Meaningful. Maybe
so
even
wonderful.
This postpartum research, because of, like, that almost makes me want to cry. Because of what my mother, I feel compassion for her.
Yes.
I love that woman. I love that woman. And I wanted, I just wanted her to love herself. And I didn't witness that she did.
Yeah.
I think she was tortured by some of her own things,
her own mishigas.
Yeah, that she couldn't forgive herself for. And I just want women out there who've ever had this kind of stuff to be able to forgive themselves, have compassion, and also, hey, get the help from someone like you.
Yes, absolutely.
That there's help.
Yeah, one of the things that I get saddest about in this day and age, and like your mom obviously had you and my mom had me. So, what? I don't want to say how many decades ago, but anywho, so it was a different time. But, even when I started working in postpartum depression during the 1990s, when I was training at Yale, the OBGYNs didn't want to deal with it at the time. They were terrified of it. They didn't, Prozac had just come out, and can we give this medication to women who are breastfeeding? And my research studies show that, yes, you can. And so, again, that was my goal, is to say, hey, these women need help. And especially if they're having these obsessional thoughts, then this particular class of medication can be really helpful. And so I remember the first time that I gave a breastfeeding woman who was participating in my study an SSRI, one of these kinds of antidepressants. And I was like, oh my gosh, what am I doing? But, I had data to suggest that this was absolutely fine. And then after doing 2 of these studies, we showed that, yes, this is fine. This is, baby doesn't get enough of this medication to actually, impact the serotonin system. And so, and I won't go into the model that we use to determine that, but the bottom line is that I felt at that point we could really tell women, look, you can take these medications in the postpartum period. You can also take them during pregnancy, despite the fact that the FDA just convened a workshop to question whether, after all these decades, can we give people SSRIs or other antidepressants during pregnancy? And the data is over and over again saying, yes, you can. But this is another time where people are like, oh, let's just have these women suffer. Like, seriously, there's not enough therapists. I personally feel incredibly blessed that I can participate in psychotherapy. Most people don't have that opportunity. They don't have the insurance to cover it. If they do, they can't afford all the copays that come with that. There are a lot of therapists out there that don't even take insurance.
That's right.
So you're paying out of pocket. So, yes, if we had all the therapists in the world, and I'm sorry, ChatGPT bot therapy is not the same as sitting with somebody, even if you're looking at them, through Zoom. It is not the same.
No.
We as human beings need that connection. So I'm sorry, we don't have the possibility to just give, oh, you're depressed. Let's let you live in a bubble throughout your entire pregnancy. No, you need to treat women, and you need to treat them with evidence-based medications as well as psychotherapy. And so I get really frustrated when...
Well, and passionate. I love seeing your passion. No, because it's important. I mean, it changed, like I said earlier, when I had I had my fist drawn back. And I mean, if I had not gotten on, and I did go to trauma therapy as well. So like you said,
Sure.
the psychotherapy plus some hormone therapy
Yes.
changed my life and
Exactly.
my son's life.
Exactly.
He has had a much mellower, happier childhood thanks to medication and psychotherapy
Yes,
of
and-
his mother. And if I hadn't had that, and that should not be a thing of privilege.
Exactly. It shouldn't be a thing of privilege. And we shouldn't have leaders that are dissing it and trying to bring suspicion about this. Because quite frankly, you said you were a runner, right? You
Yes.
exercised. Well, great. Yes, exercise is very good for the brain. And I tell people this all the time. It increases something called brain-derived neurotrophic factor, which is like fertilizer for your nerve cells.
That's exciting to hear.
And it's lovely. It's lovely. But it doesn't cure depression. It helps, but it doesn't cure depression. It doesn't cure bipolar disorder. It doesn't cure schizophrenia. It doesn't cure PTSD. So, and it's not going to prevent people from having those problems. I mean, think about all the premier athletes, that they're really physical specimens that are just, they eat well and they exercise, and they still suffer from psychiatric illnesses. And you could say, well, it's all the stress. Well, maybe, but still, it's like, it's not like all of this exercise cured them. And so I am thinly veiled here, maybe not so thinly veiled, punching, a button here about like this whole focus now that we're just supposed to like eat well and be healthy with our exercise, and somehow that's going to keep us from having mental illness. And I'm just like, that really says to me that our leaders don't really understand neuroscience, biology, and just, human health.
Yeah, period. And that is the end of a sentence. They don't understand. And that's why we have got to do philanthropy, and we have got to call our representatives and vote. I'm going to say it. Please vote. And please, and I love what you said earlier about, and I know it's like, are we going to ever change anyone's mind? But the only way we will is to try to understand them. I'm going back to what you said earlier, when we're faced with somebody who is a skeptic about science, and like, okay, and anyone listening to this, I was just thinking, like, you're so, like I say, you're rooted in the earth. You worked in the tobacco fields. You know what I mean? You were out there working in the fields. What were you doing? Were you picking tobacco? How does it work?
I did everything. I cropped. So I was like on those old-fashioned harvesters where you're sitting like 5 inches off the ground. The trailer is, pulling this like structure, and you've got tobacco leaves hitting you in the face, and you're like reaching in and cropping the leaves that are ready to be harvested, and you hand them up to somebody who then basically, we used to use these wooden sticks, and you'd have twine, and the person was a tire, and so I was a cropper. I hand it to the tire. They would basically tie it onto the stick, and then when the stick is full, you've gone the length of the stick with all of these little bunches of tobacco. Then somebody, you call stick, somebody comes and picks it up. They're standing up on this tractor that's moving around, and then they lay it on a trailer. And when the trailer's full, we get a new trailer, and then somebody takes the trailer to the barn. So I did every single job. So I was a cropper. I did the tying. I did the picking up the sticks. I actually climbed 20 feet high in the barn and would poke the tobacco and pack it into the barn.
Because it needs to get packed down.
It has to get packed into a barn. So you're standing spread eagle on these like big timbers that are up in the top of the tobacco barn. And basically picking up these 25-pound sticks.
You're a badass. I mean, you really wanted those Levi's, I'll tell you.
I did want those Levi's.
Well, I do remember, because I think you're a little younger than me, but yeah, Levi's were the thing. And
they were the thing.
I was raised in the O's. Oh, yeah. Wait, which one was the 501s?
Oh.
I do remember. Would they button up fly?
Yes. Yes.
The 501. God, that takes me back. So in closing, I feel like we have to get towards closure, but I don't want to.
I've got to work on my comedy bit for the 5th.
Yeah, we're going to work.
Yes.
You're going to present. I'm hoping, and I know that's going to happen, is that I think what's inspiring, and you've already shared so many things that have changed lives, but that we know there's just better live. I mean, I know this is a cliche, better living through chemistry, but through the right chemistry.
Yes.
And so that we don't have to suffer.
Please. That's the thing that makes me the saddest is when I sit down with a woman who has been struggling for years, whether it be, mood and cognitive issues after going through an oophorectomy, which is a surgical menopause.
Removal of the ovaries.
Yes. Or, having a postpartum depression. I had people would come to me and say, I didn't know I was depressed until, because, having a baby is stressful and it's hard.
And you don't sleep.
Yes, exactly. And it's really hard. And, I never realized that I was really suffering from depression until I looked back at after my baby's first birthday, and I'm looking back and going, oh my God, I've been miserable this whole time. And that just makes me so sad because somebody could have done something for that woman.
Yes.
Much, much earlier.
And for the baby.
Yes.
I mean, because it mutually benefits.
It mutually benefits mom and baby. And that's why I think we have to really keep talking about these things and making people understand that, like, for example, postpartum depression is, if it's not the most common, it is like the second most common adverse effect of childbearing. So, some people have bleeding, some people get infection and things like that, or become hypertensive postpartum. But, postpartum depression is just that common, and depression during the menopause. I mean, women who've never had a depressive episode can have their very first episode as they're going through menopause. And there's no reason to suffer because, quite frankly, menopause on average lasts years. The whole transition lasts years.
Yes. It's over a decade sometimes, right?
Sometimes, yes, absolutely.
I just remember one time, how our phones are like a black mirror, and I just remember seeing my face, and it was beyond resting face. It was like, I'm like, my son is looking at this. Like,
yes.
And I know I'm codependent. So let me just say, I'm in recovery program for codependency. But it like, in a weird way, somehow I can't get help unless it helps my son. But it's worth it to do it for yourself.
Yes.
I mean, but as mothers, I mean, if I can even appeal to you, if you're also codependent, do it for your family. Do it for your extended community. Because I was just like, ooh, I'm scowling.
Yes.
I am literally, and I didn't know, like, that was my sign. I didn't know how miserable I was. Like you're saying, she saw that in pictures. Maybe her face looked miserable.
Yes. Or just,
she just had a memory of how unhappy she was.
Unhappy. And it was the event of her child's first birthday that made her stop to, I think people, when they have events, they do stop to take, a sense of themselves and sort of where things are, and like, wow, that's been a year, and oh, wow, yeah, it's been a whole year where I'm pretty miserable. But one of the things that when I did my menopause, surgical menopause study, where women were enrolling in my study for executive functioning problems, they said to me, and it didn't matter because I enrolled people from all over the country, and they said to me that they had been to their primary care doc multiple times, and they said, we just don't know what to do. And I felt really sad because I'm like, well, that's why I'm doing this study. And to a T, all the women, I mean, some of them had been suffering 5 years, 10 years, 15 years. They said to me, thank you for doing this research, because we had no idea what to do to solve this problem and to, really try to improve my condition. Because some women were like, I've left the job force, or I just don't feel like I'm doing as well at my job. And so my self-esteem has also gone down.
Yeah, and confidence. My confidence has gone down with my cognitive. And then I had a show called Mental Pause there for a while. Yeah. But so what, is it the hormonal therapy that helps the most for that?
Well, in these women, hormone therapy wasn't an option for most of them, because if they had cancer, then they, like breast or ovarian cancer, they were not, couldn't use hormone therapy. And so the goal of this study was really to look at this as new onset executive functioning difficulty, sort of like ADHD, sort of new onset attention deficit types of problems. And we didn't call it that. We called it just new onset executive functioning difficulty because ADHD, again, in the rules and our diagnostic manual, you're supposed to have onset in childhood. And these women were having onset after this surgical procedure. And again, you could arguably say that they had some biological vulnerability, that when we removed their ovaries and thus they had a crash in their estrogen levels, and then they couldn't take estrogen, that, the part of the brain that is important for executive functioning was kind of a double hit. It was not only that they had this predisposition, but they also lost the estrogen. And so we basically used ADHD medication in this study. It was lisdexamfetamine, which people might know as Vyvanse.
I love my Vyvanse. I want to get a new prescription for it. I'm going to.
Just because, so it is an off-label use, but that's why you do research. Because, for a primary care doctor to feel comfortable saying, oh, I'm going to now prescribe this, they need to have a paper, data that shows them it was safe, that these were the potential side effects, but this was how much better it was than placebo, and what dose to use and when to see the effect. Like, we saw a separation from placebo, meaning that it was better than placebo within 3 weeks. And so it's a fairly short window of time that you would know whether this is going to help a woman or not.
I got to tell you, I feel it within 3 hours. I would like to say.
Right.
But
you have to, and I'm not saying that they didn't, but we didn't test them again within 3 hours.
I can see such a difference. Thank you for validating that.
Yes.
And I just want to say, truly, thank you from my whole being. Thank you for dedicating yourself to this, to using the gifts that were given to you by whatever, the universe, your parents. I'm so glad that you're in the world. Thank you. Thank you so much for what you're doing.
Well, thank you. And thank you for really inviting me to be here. And thank you so much for using your skills as a comedian to really help people feel comfortable with themselves and comfortable with life and all what it means to be a human. I think that's what the comedians really, they really call us to look at our humanity in a way that is just much more self-forgiving and gracious, not only towards ourselves, but, providing that gratitude and appreciation for others and empathy for others. So in any case, thank you for being helping us be human.
Oh, thank you. I'm going to take that in. I'm going to take it in. Thank you so much. I think this is going to be a wonderful collaboration of scientists and comedians, September 5th at the Bug Theater in Denver. You can get tickets by going to brainfestdenver.com. Dr. Neill Epperson, thank you so much.
Well, thank you. It's great to be here. Come to the Bug.
I want to thank my guest, Dr. Neill Epperson, MD, Psychiatrist, Chair, CU Anschutz Campus. I don't know why. I want to mess that up every time. Please look at the show notes to go to brainfestdenver.com. Find tickets for Headstrong Comedy, for scientists, for comedians, one fun night. I don't know. I was trying to do some math jokes about that. 4 + 4 = 1. 4 comedians plus 4 scientists equals 1 fun, empowering night. Okay. I want to thank my son, Nancy Norton, for putting together this music loop. And I want to thank you, the listener, once again, for being on this healing journey. It makes a difference. Please share Traumedy with anyone you know who might be benefited from it. And remember, no matter what, keep laughing.